one in which I've been very interested in is a lot of the brain injury, post-traumatic stress and traumatic brain injury that we're seeing in a lot of soldiers coming back from Iraq and Afghanistan. With this war that we went through, the difference between the survival rate of the soldiers that are coming back is much greater, 9 times greater, because we have the ability to get the injured soldier back to a field hospital faster. And if you get back alive into those field hospitals, you have a 90% chance of recovery. Oh, not recovery, 90% chance of living. Unfortunately, there's a lot of soldiers who've had major brain injury who are surviving, but not surviving adequately. I personally have seen a lot of patients with traumatic brain injury from the IED blasts and other blast injuries, and frequently come in with cognitive issues, memory problems, headaches, inability to sleep at night, agitated. The government, in their wisdom, has decided to utilize medications such as antidepressants, anti-anxiety medications, and other preparations such as that to treat the soldiers. And they perceive that they're treating the patient because if 100 soldiers came in January and by December only 10 were left, they consider they had a 90% success rate. Well, what they don't put into this whole factor is that there's a large number of these soldiers, unfortunately, that commit suicide. Okay, very high percentage. Matter of fact, more soldiers have committed suicide in the United States if coming back from Iraq and Afghanistan than actually died in the field. We have found that using hyperbaric oxygen therapy, we get a much, much better response. By the way, before I transgress into what the results we had there, let me tell you that the soldiers, unanimously that we've treated, have stated that the drugs have made them feel numb and dumb, and they stopped taking it. So the reason why in January you may have 100 soldiers and in December you may have only 10 is not because they did a wonderful job, it's because they dropped out. They stopped going for follow-up visits. Instead, they found that street drugs, alcohol, are better calmers of their ills. Unfortunately, that causes them to have poor ability to hold a job. There's a major number of these soldiers that have spouse abuse. They went up in jail, and we become, unfortunately, people who live on the street. We have taken many patients, both what I've treated and an organization I work with, have taken these soldiers and treated with hyperbaric oxygen therapy. And it's amazing, the first day they come in, they have what we call flat affect. They're emotionless, and they're almost zombie looking in that regard. And they answer the questions. They're usually slow in answering the questions. They have to stop and think a lot before they answer those questions. And by the end of the week, because we normally do hyperbaric therapy 5 days a week, by the 5th day, when they're coming in, so they only had 4 treatments. By the time they come in the morning on the 5th day, you look at them and almost unanimously, you see something on their face you didn't see before, and that's a smile. And then you look at them and say, what happened? You go, I don't know. And they start smiling for the first time. And family members say, he's not smiled since he came back from Iraq. And then as time goes on, their sleep improves, headache is reduced, their nightmares and reliving a lot of the battles they had been in subside. I had a soldier that I treated that when his wife would drive him from one place to another, he'd be looking in all the strip centers, looking to see if there's anyone who has a gun or a weapon that's going to aim at the car while they're back in the United States. Also, these soldiers have a tendency to sleep with guns or knives underneath their mattress because they feel in the middle of the night they may have to go up and protect the family. Those all subside. I've had soldiers that came back from Iraq and Afghanistan who could not hold a job, who were on drugs and alcohol, who completed the program, which for them is between 40 and 60 treatments, and they've gone back to school, some have just completed a college education, some went on for a PhD. They're holding jobs now, they have a family, have an apartment on their own, they're not living on someone's floor, and they're doing the American dream. Okay, a job, family, children, dog, okay, and a job, okay? And that is the most fascinating, and it's without the pharmaceuticals. There's a sheriff of Pasco County just north of us, who went to Fallujah, Iraq in 2005. And he went because I think some other police officers from Pasco County went, so he went to join with the group. And in his first 6 months, 8 months he was there, an IED blast took out the front third of his brain. So both frontal lobes and half of both temporal lobes were blown away, and obviously survived due to the good care that he got in the field, and subsequent when he got to the hospitals in Germany and the United States. He did survive, and but they were treating him from 2005 to 2010, and during this period of time he had no movement at all of the left arm and leg, and could only speak a handful of words. I was contacted by a physician and who told me the story about how he was injured and asked if I could help, and I said, sure, send him over. We treated him. Within the first week, his speech improved significantly. By the end of the first month, he started moving the arm and leg that he couldn't. By the end of the second month, he was moving enough that we could barely get him up to a standing position. So in other words, he was 5 years wheelchair, never stood. We got him to stand, albeit with me, my technician, and his mother. This guy's like 6'6" and is like 280 pounds. Okay, big guy. We held him up so he could stand. By the end of the next month, he was walking with a walker, and the month after that, he was walking with a cane. And today, he has full strength of the arm and leg. Speech is phenomenal. Memory is intact, and he doesn't even use a cane. We have videos of him getting on his horse, riding it. We have videos of him going into the stall where his horse is and shoveling the manure out of the stall. And he's, I mean, I'm not going to say he's 100%, but a man who for 5 years never got out of a wheelchair, who is now able to function, it's pretty dramatic. The reason why it seems the hyperbaric seems to work for brain injury, and particularly in this case, this soldier with brain injury. Hyperbaric therapy causes new blood vessels to grow into any part of the body that's not getting adequately perfused with blood and nutrition. Now, conventionally, every day in the hospitals across the United States, there's 14,000 treatments done using hyperbaric therapy. Most of the time it's for wound care, however. Now, a reason why a wound develops is because you have an area that gets either traumatized or there's poor circulation to the area, and since there's poor nutrition to the area because of poor circulation and inflammation, you wind up not getting adequate perfusion of nutrition to lay down the framework for healing and let the wound heal itself. Now, I take that example and I say, well, hold a second. A stroke or brain injury is a trauma and is a wound. So what's the difference between the two? I mean, you have a wound in the leg, which you say we know heals well with hyperbaric. Why not the brain? And I equate the fact that people who've had a stroke have had a blood vessel that went to a part of the brain, got closed off, either from a blood clot or a calcified plaque, or even a ruptured blood vessel where the blood just leaks out of the blood vessel itself and causes pressure on the normal brain structures. Well, it's the same phenomenon where you get increased blood perfusion to the parts of the brain that survived. There's part of the brain, when you have a stroke, there's a central area of dead tissue. Now, we're not resurrecting the dead, okay? However, there's an area around that tissue that's called the penumbra, which is sleeping, dormant, idle brain cells. And in other words, in order for that to survive, it must be getting some nutrition through capillaries or through other means into that tissue, just to let it stay alive, although not enough to make it function. So with hyperbaric therapy, you're getting new blood vessels to grow into that area, to give it perfusion, to give it nutrition, to carry away the waste products of metabolism, the toxins that are in that area that cannot be pulled away because it's not a vascular system to pull away the toxins. It makes the area heal and give nutrition to those areas that are still alive. And if those areas do have a function, if it's a functional part, such as the motor function of the body, or the sensory function, or the speech function, or the balance function, or the visual function, if it has a function, you can bring a good deal of those functions back. And that's why